I'm still on the I'm on the needle here, or the vial, whatever it is that you want to call this business, that we have gotten down to that level again. Sure. Because if we are talking about having to share a vial that you use to draw blood to then inject medication, we are talking about some serious health risks here, and that we are whittling it down to that there's not payment. So we can't risk using a fresh one because we don't have supply and we don't know if we're going to
increase cost.
Are you kidding me?
Sure, that's it. Look at it also this way. When payment does not come, you also don't have reagents in the lab.
Yeah.
So what happens? You will end up treating this client clinically. Yeah, just, is it headache? Is it this? Is it this? That's how it will go.
And we go to sometimes possible misdiagnosis over a number of things.
Exactly. So that's why we are saying when we talk about the quality of care to the patient, it must work hand in hand with the reimbursement.
So we have a health system that is a health system that is working so hard to exacerbate the conditions and even cause death. Because when you talk about the low quality provision of the care that is needed, contamination could happen, right? 2, misdiagnosis will happen. And of course, you don't get the appropriate care that you should be getting from that facility. And we have an entire ministry that will come up and say 11 billion was lost, and the whole CS cannot find a reason to resign. Have you called for resignation of some of these people as an association?
We've done our part, and we've given our suggestion across. I think personally I've not been here once.
Yes.
Yeah, and these are the same conversation that we have. Even today I have said you need the tripartite discussion to have things work well, because we can be able to put this thing to each other across the table and help, challenge each other to do better.
Yes.
The only discussion should not be fraud. It is an element. It is an element, but healthcare is not only about fraud. It is an all-round thing. We are still making noise about the level 3s and level 4s that were, denied the right to admit.
Yes.
And when you are denied the right to admit, it means you can't even conduct a delivery, because where will you keep this mother?
Yeah.
You see? So you end up putting a lot of pressure to level 4s and above, because that's where now they have the right to admit. There is still this big question of mismatch, where a facility is, the papers were changed midstream, and you are told you are level 3A and not 3B. You are 3B, not 3A. And that confused the way service is provided. Out of that mismatch issue, first of all, when there is mismatch, the facility is not being paid, because they say that we are
have to
investigating.
wait and figure this out.
Oh, sure. So you see, there are facilities that has gone for months, actually some from November last year, without a single payment, simply because of mismatch. And what is this mismatch? The certificate of registration of a facility is such and such hospital limited. And the limited in the certificate of registration is written in full, limited. But what SHA captured is LTD. That is a reason to keep a facility out.
Oh, Dr.
For real.
Yes,
like,
that's for real. I'm actually giving you examples that are there on the ground.
So based on that, they cannot get authorization for reimbursement or for payment.
And when that happens, there are a number of maternity beds that have been closed. They can't be used. So where are those mothers going in that region? There are a number of beds for medical use, that the medical patients that are not being in use. Where are those patients going? They are going to affect other facilities, level 4s and in the other levels that are